The 10th edition of the Twitter Files reveals the government was working to silence any debate around COVID-19 policy. David Zweig, journalist from the Free Press, finding, quote, the United States government pressured Twitter and other social media platforms to elevate certain content and suppress other content about COVID-19. He also tweets Twitter did suppress views, many from doctors and scientific experts, that conflicted with the official position of the White House. As a result, legitimate findings and questions that would have expanded the public debate went missing. Fox News medical contributor Dr. Martin Makary is here to react. Dr. Makary, what do you think about this?
Well, good morning, Carly. I don't know if this looks more like the Salem witch trials or modern-day McCarthyism. But in other countries, this has been going on for a long time, where state-controlled media censors all information that is not aligned with the leading political party in power. And that's sadly what we're seeing right here. Look at the amount of misinformation put out by the government itself, by public health officials, ignoring natural immunity, that the vaccine has a risk-benefit analysis that strongly favors vaccination in young, healthy children. We've never seen that data. That closing schools would reduce transmission in young people, that the vaccine works in 6-month-old babies, or that fluvoxamine was ineffective. There's a long list of misinformation from the government. They just wanted to change the narrative, and that's the sad part about its impact on science.
Yeah, it certainly is. And Twitter did not approve of this tweet from Dr. Martin Kulldorff, who is an epidemiologist at Harvard Medical School. He posted a tweet saying, no, thinking that everyone must be vaccinated is as scientifically flawed as thinking that nobody should. COVID vaccines are important for older, high-risk people and their caretakers. Those with prior natural infections do not need it, nor children. Twitter flagged that post as misleading, even though what he was saying seems to me to be non-controversial and accurate.
Look, I know Dr. Martin Kulldorff from Harvard extremely well. He has been one of the smartest, most accurate minds on COVID this entire pandemic. And the idea that somehow someone who served on the CDC's advisory group on child vaccinations, who was dismissed for having a different opinion, which ended up being a correct opinion on the J&J vaccine pause during that thing, it was somehow excused from public comment because, you know, he disagreed with the authorities. That's unfortunately the state of repair that we need to engage in.
So what do you think the consequences of this legitimate censorship by both Twitter and the government is?
Well, I think public health officials look really bad for this. The public needs an apology. I think, honestly, Carly, I've thought a lot about this. The simple, most feasible solution right now to a lot of this censorship stuff is not only to stop the censorship, it's to end the ban on scientists and doctors who work in the government from speaking directly to the media. Right now, the 20,000 employees at the CDC cannot talk to the media. No one can take a call from a reporter. It can only be the director or a person who's officially approved. That needs to end. Science should have no gag rules in science. A lot of people at the NIH told me they were extremely frustrated with Fauci. A lot of people at the FDA told me that it was a horror movie that they were forced to watch this entire approval process.
Yeah, some of these doctors that were censored and are now being named in the Twitter files, they must feel so justified right now. Do you think, Dr. Makary, that you were among them, that maybe some of your posts were censored?
Well, I know Facebook censored one article I wrote in the Wall Street Journal that talked about natural immunity, something that ended up being stronger than vaccinated immunity, and which drives community and population immunity now around the world. We're seeing in China right now the lack of a natural immunity result in that epidemic. But I don't know. You know, I know the people who were censored. I know Jay Bhattacharya and Martin Kulldorff very well. They're not bitter. They're sad for the state of children right now recovering from the policies that they worked very hard to try to challenge.
Yeah, I just can't get over how the first instinct by both Twitter and the government was to censor people, especially when it comes to medical information, which it's so important to have a debate. I mean, there's no settled science in this. And oftentimes
Right.
what we're finding out is that the things that were being tweeted ended up being right. You mentioned Dr. Fauci a little bit ago, and Saturday actually marks his final day in office before stepping down as White House chief medical advisor. I know you have an op-ed coming out about his career. How will you be remembering Fauci?
Well, look, a lot of people are frustrated with Dr. Fauci, even very angry at his so-called evolving recommendations. But that's not my beef with Dr. Fauci. It's not that he changed his recommendations. Changing recommendations as you learn things is the normal, healthy process of any doctor. The concern I have with Dr. Fauci is the way he managed the agency for the last 38 years. The agency that he led failed to do the critical research we needed during COVID. And as a result, we ruled by opinion and not by evidence. All the big studies that we needed on all the big topics were either a year plus too late or absent. They did not fund the critical research we needed to know it was airborne, or that natural immunity was effective, or that vaccines had complications. All these critical studies were not done by the agency. Instead, they poured $1.2 billion into long COVID and other priorities that just really didn't help us on the ground taking care of patients with COVID.
Yeah, so it sounds like it might be a very good time for a change of leadership. Dr. McCary, thank you so much.